Welcome, future doctors, to another episode of the Future Minority Doctor podcast with Dr. Zulma
and Marina, where we bring you conversations to empower and inspire you to contribute to your community and the world by becoming a doctor.
Hello, future minority doctors. Glad to have you all join us once again. Today I have the great pleasure of interviewing Dr. Ricardo Salas, who has a medical degree and a master's degree in public health. Dr. Ricardo is a hematologist oncologist doctor. I know. What in the world is a hematologist oncologist doctor? I didn't even know what this was when I was in high school or probably even college. Well, we will be finding out more about this specialty today, but to put it short, this is a doctor who deals with problems in your blood or if you have cancer. So go ahead and turn the volume up and listen to what it's like being a blood and cancer doctor. Thank you so much for being here today, Dr. Ricardo, as I know you are a very busy doctor, husband, and father.
Zulma, it's my pleasure to be here and certainly to share in this venture and certainly share this specifically with our future minority doctors. So thank you for the opportunity.
Wonderful. So before we jump into the world of what it's like being a blood and cancer doctor, I would like our future doctors listening today to know who Dr. Ricardo is. Can you start by telling us about your upbringing and your background first?
Absolutely, yes. I think it's very important. So, I grew up in Selma, California, near Fresno. For those of you who know where Fresno is, Selma is a very actually small town. It's maybe about 20 minutes south of Fresno. Population is really small. I think when I was growing up, it started off maybe about 12,000. When I left Selma, it was maybe 20,000 or so. But it's a small farming community. We grew up as farm working children, my sister and I. We traveled up and down San Joaquin Valley, picking anything and everything under the sun. And up until the age of about 18, believe it or not. Then I started working for Burger King. So then I worked for Burger King while I was actually going to school. I actually ended up going to community college first before I transferred to UC Berkeley. And so I got my undergraduate degree from UC Berkeley. And then after that, I ended up getting a master's in public health at San Diego State, and then followed by medical school at Charles Drew University UCLA joint program. And that's where I spent at least 4 or 5 years there before starting residency. But I did pretty much all my training in Los Angeles. So I did my residency training at Olive UCLA. And then I also completed my fellowship training with a joint program there at UCLA. Olive U, and it was a joint program with Kaiser and Cedars-Sinai Medical Center. And finally finished in 2017.
The journey, I know. It's a long journey.
Yeah, absolutely. I think, what's unique about, at least about my upbringing in terms of at least certainly the trajectory is very non-traditional. It's very non-traditional because I actually ended up doing community college. And then I went to undergrad, then did a master's in public health. Then I worked for a while. I worked for the American Cancer Society. So I worked in San Diego for some time before I actually went to med school. But med school had always been the number one priority, always been my objective in terms of reaching. And so I just took a different path, but still got to the same place. It took me a little bit longer, but I got there.
Yep, that's what matters. What degree did you get in undergrad?
In undergrad, I did molecular cell biology. But if you ask me today if I can go back and do it all over again, I think I would do cultural anthropology. I would do probably something that I know I probably wouldn't be able to get to do again, right? Because that's really the opportunity for you to really explore. You're going to go into the sciences. You're going to deal with a lot of the sciences for the rest of your life. But really, your undergraduate years are really the time to also explore different options, not in the sense of careers. I knew I wanted to go into med school, but I always was interested in cultural anthropology. Don't get me wrong, molecular cell biology fits my field perfectly. At the time, I didn't realize I was going to go into oncology, but it came together nicely because that's all I deal with, and at least in our career, in our fields here in oncology.
And are you the first doctor in your family?
I am. So I have an older sister who's an LVN. She works in a nursing home. My parents, I think they barely finished elementary school. So yes, I am the first in my family to go to college, first in the family to be a doctor. And I don't think I have any aunts and uncles who are doctors or cousins. No, nobody. Pretty much the first of everything.
Hence the journey, right?
Hence the journey. I got to say, going that path and just, it's a trial and error. And it's like your parents can only help you so much. But I'll tell you one thing. I think the most important part of this whole process is, as you mentioned, it is a journey. And even though, my parents could only help me so much, but there was I feel like God put people in my life who help mentor me through the process and to help get me to the place where I am today. And the one thing's for sure, I think becoming a doctor for me it's not a job, it's not a career, but a vocation. I feel like that was always my purpose, even though I took a very non traditional route, but I always felt in my heart that there was no plan B. This was the plan A, and that's it. I was going to become a doctor. I knew I was going to do it. I just felt it. I didn't know how. If I just had to figure it out, and sasa pansaso sometimes,
Yeah.
and it's part of the journey, part of the humbling experience. And part of being humble is very important in this particular field. And so many humbling experiences, but I think that's who makes us who we are. And part of this vocation, I really feel like any vocation, whether it be a teacher, an attorney, the male person, we're all serving others in one way or another. And that's the most important thing. I think when we ask ourselves, what is our role in this earth, or what do I want to be when I grow up, or the first question is, how can I serve others best? And how can I pick a field that helps me achieve that? And that, like I said, that field could be anything. Your financial advisor, so many different roles, but you're serving others. And I think that's the most important thing. And for me, I think God put me in this position to become a physician, put me in this earth to become a doctor and fulfill that vocation.
I could definitely agree with that sentiment. If not, I don't know how we would stick with this long journey, right?
Oh boy,
But
it's hard.
it's hard, but it's very rewarding. So I agree with
Absolutely,
you.
every minute of it. And I think for our audience who are seeing this, I think it's very encouraging for our audience to understand that as long as we have the willpower, that passion, that drive, things will absolutely fall into place how they're supposed to be. And eventually, as long as you don't give up, you will achieve your goals and your journey. Absolutely. Absolutely.
Thank you so much for those inspirational words, because it's a great way to start this. So that way we got open ears, because I'm sure somebody is feeling self-doubt at one point or another, and the entire way, I would say. Now, so you chose to be a hematologist oncologist. Can you
Yes.
explain exactly what that is? And just for
Yeah.
people who don't know, because I know I would have been a high school or college student that may have not known what that was. And then what a typical day, if you have a typical day, what work is like.
Yeah, absolutely. Absolutely. So, hematologist, oncologist, it's actually two parts. You actually get board certified in these two different disciplines. One is medical oncology, the second one is hematology. Let's start off with hematology. Hematology is basically the study of blood and the diseases associated with blood. So, what does that mean? That could be your typical anemia, right? We see a lot of anemia in the community. So it just means your red blood cells are a little bit low for various reasons, right? And we call these sometimes conditions that can be either benign, meaning non-cancerous, and or cancerous, so blood-related cancers and disorders, etc. But anemias, some of you may have heard of thalassemias, for example. So it could be like an inherited disorder that comes from generation to generation. Some populations are a little bit more predisposed to it. That can also contribute to anemia, etc. But it's really just the study of blood and its associated diseases. And like I said, those diseases can be non-cancerous or cancerous, like leukemia, who we have all heard of. And so, in a nutshell, that's kind of the study of hematology. And it's very challenging, it's very cerebral. I mean, there's so many diseases, so many different mutations. The blood is so important, carries so many important life essential, well, for example, oxygen, right? Which is so important. Without oxygen, we don't survive. Without blood, we don't survive, So it's an important mechanism keeping us healthy and alive. The study of oncology is obviously the study of cancer. And those what's the difference between, in the sense of, well, leukemia is a cancer. How come that's not necessarily oncology? Well, it is oncology. But the study of oncology itself also focuses on solitary tumors. So you've all heard of a colon cancer or a lung cancer or a brain cancer. These are solitary tumors in which medical oncology studies and treats, etc. But we also, under oncology, also treat lymphomas and leukemias. So it's very broad for the most part. Hematology is getting a little bit more focused in those other avenues, as I previously mentioned. Of course, benign, which are non-cancerous causes, of different types of blood disorders. The question also is why hematology oncology? Why did I choose that field? And the reason for that was probably more from an experience growing up. I saw my aunt suffer from ovarian cancer, which is one of the cancers that has the worst prognosis because typically it's caught late. And unfortunately for her, it was caught very late in her course. And fortunately, she did not have insurance. She had a hard time accessing insurance and health care. I saw, I thought it was just very unfair. I saw how much she struggled and how much she suffered simply because she just had lack of access to care for various reasons. And she suffered. We were with her from the start to the end. And at the end, she suffered a lot. And I think for me, it kind of just set something off, especially, in the field of oncology. And I think I've always had that in the back of my mind since that experience. I knew I always wanted to become a doctor, but I didn't know what kind of doctor. And so I think that kind of really planted the seed. Fast forward to today and what my typical day would look like. Wow. Well, I get to eat. Sometimes no, just kidding. My typical day, I see anywhere between 20 and 25 patients in clinic a day, and it's a mix of patients. Some patients come in to see me for anemia. Some patients come in to see me because they have a new diagnosis of a cancer. And so on average, I probably see maybe about 60% cancer, solitary cancers, maybe about 40% benign, meaning anemias, other blood-related disorders that are not cancer. And then I also see new patients. So, 20, 25 patients doesn't mean these are all new patients to me. A lot of them are follow-ups, meaning patients that I'm following along and trying to get them better for various reasons. And new patients in a typical day, I may see anywhere between 2 to 3 new patients in one day. And why do I not see, 20 new patients in one day? Well, every patient they require as much time as they need, but you won't get through the day seeing 20 new consults, of course. But we work with nurses. I work with nurse practitioners who also help me execute different plans for patients. A typical day also includes following up patients who are receiving chemotherapy. So as I previously mentioned, I treat patients with cancers, of course, and solitary cancers. So for example, lung cancer, a patient who's on chemo, have to make sure that they are tolerating their chemotherapy, make sure that they're not having adverse reactions, making sure that everything's in place to get them through their chemo. And there's a certain number of chemo cycles or the amount of chemo that we give patients. So again, we have to make sure we don't give them too much chemo and so forth. So it's really helping patients get through their chemotherapy treatments and so forth and making sure that they're not progressing, the cancer is not growing. So that also requires making sure that imaging is also ordered at the right time. And so it's a disciplinary team approach where you also have to work with radiologists, you have to work with, like I said, your nurse practitioners, you have to work with your radiation oncologist, your social workers. So every day I involve them in the care of patients. So it's a very multifaceted, multidisciplinary approach when you're caring for patients, particularly in this field.
Do you work in a clinic or a hospital or
Good
both?
question. So I work in both. So when we're in clinic, usually this means the patients come at a scheduled time for their follow-up appointments and so forth. When I work in the hospital, that's typically when I see new patients, or if my patients end up being admitted into the hospital, I follow them along in the hospital and see them in the hospital, along with new patient consults. So these new patient consults can arise for various reasons. Patients throw up in the ER because they have a mass in their neck or something, and it turns out to be lymphoma. And so we would essentially be called to follow this patient and work this patient up. And eventually this patient ends up following up with us in the clinic.
And then about how long is your work week, would you say?
Yeah, good question. So I'm lucky because I have a little bit of autonomy in terms of my schedule, and I work 4 days out of the week. So I work Monday through Thursday, and I have Friday, Saturday, and Sunday off. When I'm on call, I work probably maybe 10 days straight, 10 to 12 days straight, and I'm on call once a month. So out of that month, I might work one weekend plus additional days there that add up to maybe 10 to 12 days for the most part. But the hours on average for 1 week, you're looking at maybe 40, probably about 45, between 45, 50 hours maybe, working 4 days when you're not on call.
Okay,
And
great.
I see patients mainly from 8:30 in the morning, usually when my morning starts in clinic, to maybe about 3:30.
Okay. So it gives at least the listeners a good idea of what life is like if you become a hematologist oncologist. So,
Yes, absolutely.
and what is the best thing you like about what you do, and then the worst part of it?
Yes, very good question. So let's start off with the best thing. Again, as I mentioned, it's really serving others. And for me, the most gratifying and the most rewarding for me is when patients, you can see how grateful they are. The most gratifying is when I come across a patient who's a farm worker, who's in my clinic, in front of me. I am able to help. I say that because that was the whole purpose for me to go into medicine. Working as a farm worker, I saw how disenfranchised our community was and how the access to resources were very limited, not to mention discrimination, and that really pissed me off. And so I knew that I had the opportunity to experience that. And I also had the opportunity to go to school. My father always said, you know what, no matter what you do, you always have to go to school. It's something that no one will be able to take away from you. Hence why I pursued medicine, of course. I knew I was going to be an attorney or a doctor, one of the two. I needed to serve people at the highest level, in my opinion. I mean, that was just for me. That was just at least my thoughts at the time. And so, yeah, I ended up choosing medicine. But to have that farm worker in front of me is the most gratifying. And even if they paid me in oranges, and they don't even have to pay me. They could just give me a hug, and I'd be so happy, because I knew that this was the whole purpose, and this is how this has come full circle for me. Is where I started and where I'm ending, if you will, or at least once I finished my career, I ended it in a community where I treat a lot of farm workers, and that was my purpose: is coming back to my community to serve others, especially the medically underserved. Now, I also serve people who have different socioeconomic status, in terms of, very wealthy people. But I'll tell you one thing, when you have cancer, for example, it is the most humbling experience.
Doesn't
And even the most
discriminate,
wealthy,
right?
it does not discriminate.
Mhm.
One thing for sure. And it's a very humbling experience for many patients. So for my patients who, obviously, going back to my farm working patients, for example, knowing that I'm going to be able to guide them through this whole journey and serve them and help them and get them through this, so rewarded. And you can see it, they're so appreciative, so appreciative. And that is very rewarding for me. Now, of course, you mentioned, what was the bad thing about your job? Well, yes, I mean, given bad news like, Miss So and so, you have cancer and you might only have 6 months to live. Okay. But it's really how you frame things. I mean, it's how you view things, right? Many people think, I can't become a cancer doctor. There's no way. It's so sad. But if you think about it, it is hard giving patient that kind of news. But if it's going to be anybody, it better be someone who's compassionate, someone who's empathetic, someone who's sincere. And why not me? I would rather than somebody who is not in the, someone else giving this news, but in a very cold, nonchalant way, if you will. And not only that, I know that I can't cure everyone. And sometimes it's not about curing everyone. Sometimes it's about helping them transition with peace, dignity, and respect through this process. And that's also just as important as curing them. Because if you can help them achieve peace and their family, sometimes that's even more important. And so that's probably the toughest part. It is giving and delivering bad news, or, Miss So-and-so, your cancer's come back, or it's progressed, or what have you. And so that is hard. It's never easy. It's never easy. But I'm glad that I am there to help them through that process.
And as a doctor, how is it that you process those tough situations because you have to deal with the bad news or death? As
Yeah,
a doctor, like if there's somebody listening, like, oh, how would I deal with that, day to day?
right, right. Very good question. It's hard. I mean, it's like you kind of just, yeah, sometimes you don't even know how to deal with it, especially in oncology and dealing with a lot of, a lot of bad news. You have to really make time for self-care. And that's one thing that's really hard for us as doctors to do. We're so busy taking care of everyone else that sometimes we forget to take care of ourselves. Now, how do you do that? Well, you have to kind of go back and think about, what are the things that I used to like to do? And so what are the things that I'd like to do outside of medicine per se? And that's important. You have to make the time, right? That's the first and most important thing. So you have to find outlets, right? So what do I like to do? Well, I love being outdoors. I haven't gotten to do this much, and I should really listen to my own advice, but I used to love to surf a lot. And whenever I get a chance, I do. But surfing, for me, that just brings me back to serenity and peace, and just allows me to forget and just put things aside temporarily and recharge. For me, it just helps me connect with Mother Nature on a different level. I like hiking, I like doing, well, sometimes I like to go golfing with friends and just engaging with friends. And so, those are important things, again, self care and just outlets, but finding outlets, exercise, of course, just making time doesn't mean you have to go to the gym, but just going for a walk or a hike or something, those things are important to keep sane, if you will, and keep your mental health. That's the other thing that's very important in this field. You can easily burn out, especially mentally, not just physically, but mentally, of course. And maintaining that mind, body, spirit, soul, and keeping that in equilibrium is so, so important. And that definitely requires time. You have to understand that you're just as important. And if you're not aligned, then you're not going to serve your patients best. And so you really have to take care of yourself in that way.
Glad you shared that. We actually focus a large part of our podcast. We have specific episodes for self-care because we're trying to teach students from high school and when you're in college that concept, because it starts there and you have to continue to purposely practice it throughout and being gentle with yourself as well. So
it's so true. Thank God you're starting early, because it does start early. This is something you have to adopt early on. It has to be part of your life. It has to be routine for you. And you're right, it takes time. It's an investment. But eating breakfast is time and an investment. Taking a shower is time and an investment. And it has to just be integrated as part of your routine.
exactly.
Even just meditation, 15 minutes of meditation. Yeah.
Exactly. Now, you said you said I would either be a doctor or a lawyer. Is there anything else you ever considered before becoming a doctor?
As a kid, my mom always said I used to want to be a policía. So I used to say policía. And I was super young. And I think that what intrigued me about that was more than anything is probably the forensic science. So more like FBI forensics or profile even nowadays, right? Yeah, it was that. But really, honestly, early on, when I was deciding, what my journey was going to be, and as cliche as this may sound, Zulma, or cheesy or however it may sound, but one day I was sitting down with a couple of friends and we were kind of just talking about what our careers goals would look like. And I was in high school or something. And I knew that whatever career I chose, I wanted to serve others in the highest capacity. And at the time when I thought about it, and I remember clear as day, when I was sitting there with my friends, we were sitting down on a round table near my friend's pool, and there was 4 of us, and it was in the evening, around 7 p.m., and I think it was the summertime. And I remember I could have sworn that God said, "You're going to become a doctor," as clear as day. And ever since then, there was no looking back. I had doubts, and I had doubts because I was like, how am I going to become a doctor? I am poor. My parents don't have money. How am I going to? You have to be rich to become a doctor or a lawyer or whatever, or go to school or go to college. My parents, my friends haven't gone. They don't go. I grew up in a place, in an area where there was a lot of gangs, and all of my friends, except for one, didn't even graduate high school. And they all ended up in gangs, and some dead, one in a mental hospital, others, I lost contact with them. And that was my environment. I just didn't think that I was going to become, early on, I thought, college, I don't know. How do you even pay for this, But something in me was like, I'm going to do it. God has a plan for me. He said I'm going to become a doctor. There was no plan B. And then I discovered loans. I'm like, oh, okay. Yeah, no problem. We're there. I'm just going to get a bunch of loans. I'll figure out how to pay for them later on. And that's it. But my willpower was always there. And I loved to learn new things. I was really, the sciences were strong for me. I was gifted with at least liking math and physics and organic chemistry and those things, and not reading. But later on, I realized how important English is in terms of English literature. It's just as important as math and the sciences. But that being said, I discovered loans, and I was like, yeah, there was no turning back ever since then. And little by little, chiseling away, figuring out one door closes, another one will open. And for me, I just knew.
Did you ever end up joining a gang or no? Because you said a lot of
I,
your
you know,
friends.
Yeah, I didn't necessarily. No, I was not involved with gangs. Fortunately, the wrath of my father was always in the back of my mind. I'm sure you, you would.
I know what that wrath is.
Yeah, right, right. And fortunately, he kept me straight, even though my friends were taking a different path and they had, their upbringing, or our upbringing was very similar. But of course, I mean, I thank God every day that I didn't join a gang, that it was there. Drugs were
Yeah.
there.
Yeah.
And, I got myself into trouble because I was just with the wrong people at the wrong time. But I knew that if I kept going down that path with my friends that I grew up with, childhood friends, we're talking about, when we were 4 or 5 years old and growing up together, they were like my brothers. I knew that if I was going to go down that path, I was going to end up like them. And I switched gears right away. And that was probably my freshman, sophomore year in high school. Then I had a small group of friends that we shared the same mentality in terms of more. We wanted to get out of our small town and experience the world. And again, I think God has always just kind of pointed me in the right direction and put the right people in my life for that reason, to use me as a tool, I feel.
Definitely. I have similar experiences as well. Sometimes you wake up and you're like, how did I get here? I'm glad I did. But um, so a little birdie told me that you're also an officiant. Is that right?
Yeah.
Uh-huh. Can you tell me more about that? Where'd that come from? Was it before being a doctor, after?
That's too funny. Uh, no, it was after. So the way it worked out and the way it played out is that my sister-in-law was going to get married, I think, as soon as like COVID hit. So unfortunately, she canceled her wedding about 3 or 4 times. She was devastated, and it was just traumatic for everybody. And I think she had an officiant initially, but then everything just fell apart. Well, long story short, I think she had asked me to marry them. And so I was like, okay. And at the time, I had not gone through the online course thing, if you will. And I didn't know at the time even how to begin, but I knew that people actually just went online and got a certificate and became an officiant. And so I ended up becoming an officiant and marrying my sister in law. And that was in August. And since then, I actually ended up, one of my patients found out through our conversations that I was an officiant, and her goal was to see her daughter get married. And we had maybe 3 or 4 months of treatment, into her treatment. One day she came to me and she was like just kind of jittery and just, I knew something was up. And then she asked me, I'm so sorry, Dr. Salas. I'm so embarrassed to ask, but I know you said you were an officiant. Can you marry my daughter? And then I was obviously very flattered and honored. And of course, how am I going to say no to my sweet little old lady patient? And so we ended up marrying her daughter. And she got through the day well without, any issues my patient did. And that was one of her goals, that was important to her. And so, we figured out a way, we made it happen. And yeah. And so I am for hire. I am free. Okay, I don't charge for this. So
So see, you can be a doctor and many other things. You can even marry people and your patients.
absolutely,
Just don't marry your patients.
absolutely, yeah, yeah. No, you're absolutely right. I think you bring up a really good important point. But these are other avenues, right, of serving others.
Yeah.
And you don't have to be a doctor or an attorney to serve others, right? I mean, going back to that, I think it's the other thing that I think the audience should also understand, and very early on, that to make the greatest impact, in my opinion, at least as a physician, medical school gives you the tools, right? Being a human, a good person, that's innate. You don't learn that. You just are that. The world is a tough place. And medical school doesn't really teach you, once you're out, in terms of being a doctor, the big picture. What do I mean by that? Well, in my opinion, I understood this early on, that the greatest way to try to influence change for the better for patients, especially underserved patients, is you not only have to understand medicine, but you have to understand the business aspect of medicine, and you also have to understand the policy aspect of medicine. And so understanding how that works gives you so much ammunition in terms of being effective in change. And so my long-term goals may be to carry out more either an administrative role or even carry out maybe more of a political role of some sort. But I think understanding how that works is so important in being a leader and being effective in change. And so That was one of the reasons why I ended up doing a master's in public health. Some people might wondering, well, why'd you do it? Do you have to do a master's in public health? No, you don't. And right now, actually, a lot of medical schools are offering like a 5-year program where you do med school and you get a master's degree in 1 year in either public policy, an MBA, public health, et cetera. And there's so many, different master's degree programs that you can do jointly with medical school. And they do that and offer that because I think they realize how important understanding not just the micro aspect of medicine, but also in a broader respect, the macro, not just on an individual level, but a family level, community level, and so forth. And I think understanding that is so important in being impactful. And that was one of the reasons why I did a master's in public health. I think my next journey, my wife doesn't know this, and she's going to be like, "What, are you
I
crazy?"
won't tell her to listen to this, okay?
Is to do an MBA program. And so I think that's going to be later on. And so that's going to be my next journey in terms of academics, is maybe do an MBA.
Yeah, I agree. You do have to shoot high to make a change and an impact. With it, knowing there's going to be challenges, but I think it's important that you did highlight that, because for the youth and people why the reason we did this podcast is because we need more minority physicians, because in
Absolutely.
order to create that change, we need more diversity. And as we've said it many times, there's only about 5% of all physicians in this country that are minority physicians. So we
Yeah.
need that.
Yeah, absolutely. We absolutely need more representation. And the one thing too is that it doesn't matter where you come from, who you are, how much money you have or don't have. If you have the willpower and your intentions are good, you can do anything. And as cheesy as it sounds, but it's so true. It's so true. You have to will it and want it. It's not going to be easy, but nothing good is, in the sense that this very rewarding field for us was not an easy journey. We had to sacrifice a lot. It was a very humbling experience. And for those audience members who think that, oh, you need to be a straight A student, you need to have, you need to be valedictorian, you need to invent a cure for cancer before getting into med school. Okay, sure, it helps, but I'm none of those. I was not a straight A student. I did not get any awards. I think I was barely like a B+ student, if that, I did not invent the cure for cancer, but I had the ganas and I had the will, and I knew I was determined, and I was pissed. I wanted to be effective and I wanted to change things, and so you don't have to be any of those. Yeah, those things help, and yes, you should look into those things. You should strive to do the best that you can. Don't get me wrong, right? And one thing for sure, get a mentor,
Mm-hmm.
find somebody, get somebody, join a program. And it's never poor me. Do not feel sorry for yourself, okay? It's never poor me. The minute you feel sorry for yourself, you're going to set yourself up for failure. What you need to do is just brush yourself off, get back up, focus on the objective, and know why you're doing what you're doing. If you're doing this for the right reasons, you will get there. Yeah, I failed the exams. Yeah, it's demoralizing. Even in high school, maybe you never failed an exam, and then you get to college, you fail an exam, or you get to med school, and you fail an exam, or whatnot. But again, you get back up, you learn from it, and you focus on your weaknesses, improve those, capitalize on your strengths, and move forward. The minute you give up the power to whatever negative energy is around you, you lose. You have to decide, how much power am I taking back? How much power am I going to give this exam, making me feel like a failure, or whatever the case may be? If you give all your power to that exam, you end up setting yourself up for failure. You got to take that power back. The exam does not define who you are. If somebody says something mean to you, you're not going to achieve anything. You're not going to be anything. You're going to be a loser. Trust me, I've had that. I had a teacher tell me that in high school. And I was like, wow, you need to go meditate somewhere in the forest. But I had the teacher tell me that. Fortunately, I didn't believe him. But you're going to get people in your journey into this path that are going to be very negative and negative energy and so forth. You really need to stay away from those people. But again, you get that power back. Don't let these things define who you are. You know who you are, and you know your objectives.
Wonderfully said. So, as you heard, which many of you have heard in many of our other episodes, here you are, you're listening to doctors that are first generation doctors, just like Dr. Salas. Our parents only went up to elementary school, grew up in a very poor area, worked, working with the family and, just regular jobs. And we failed exams. We had people tell us we couldn't do it, and we did it. So really keep those words in your mind as you're going through the process. Anything else, Dr. Salas, that you would want to mention before we finish up?
Yeah, I think be proud of who you are. You know, the person that you were a month ago is not the same person you are today, and you're going to continue to evolve into good people, if you will. And believe in yourself. It's hard. I think we're our worst critics. Sometimes it's hard to believe in ourselves. Everybody else might, but sometimes it is hard for us to believe in ourselves. But I think if you focus on the objective and you focus on why you're doing what you're doing, I promise you, you will get there. Remember, there's only plan A. There's not a plan B. And if you keep that in mind and you keep that in focus, you will get there. Now, you don't have to get there in a straight line. Everyone's journey is different. Some take the 5, some take the 405, but you get there, right? And so I think having that objective in mind and really being proud of who you are, I think that is very important. And there is no such thing as failure. Failure comes when you give up, and all there is moving forward. Like I said, you do have to learn from failure, a failed exam or a failed whatever case may be, but you learn from that, you strengthen your weaknesses, like I said, and you capitalize on your strengths and you move forward and you just don't give up. Be persistent. And there are so many people out there who want to help you. I promise you that, including myself and especially Zulma. And this is why she's doing what she's doing. She believes in the next generation as well as I do. And this is to encourage the next generation and not to give up. And there's definitely very few of us out there. And there's a lot of patients out there who look just like us, who need us. So, keep moving forward.
Well, I couldn't have said that better. I hope you all enjoyed listening to Dr. Ricardo today and learned how big the world of medicine is. I am sure there are some ears today that heard bells ringing that this career path might be the right one for you. Dr. Ricardo did it, and so can you. Thanks again, everyone. Remember to share this podcast with your friends and family, as we are here to inspire a new generation of doctors regardless of your situation. Peace and love, everyone.